Hi, I'm Jaren Riley. I'm a pediatric orthopedic surgeon here in Denver, Colorado, and I specialize in pediatric spine surgery, specifically in the treatment of scoliosis. One of the things that we are pioneering here in Denver, Colorado is the use of a device called Vertebral Body Tethering, which we hope leads to a solution for young people with scoliosis where we can not only straighten their spine, but also keep the spine as flexible as possible and have the spine be as healthy and lifelong durable as possible. My all-time favorite thing about being a pediatric spine surgeon is I get to see these kids grow up. So a lot of times I meet these kids when they're really young, 5, 6, 7 years old. There are even several of my patients who I met before they were born. Their parents will come in with an ultrasound and they'll say, hey, on this ultrasound we found out that our baby is going to have scoliosis. Can you talk us through that? So for better or worse, I form a really hefty attachment to my patients and their parents for sure. I love, absolutely love, as they grow up, getting high school graduation announcements, college graduation announcements. Hey, I got my first job, I'm in my career, I got my internship. So the best thing about my job is being able to see how these kids grow up and how either avoiding surgery when appropriate or performing surgery when appropriate allows them to accomplish their goals. So I'll try to tell you about one that stands out in my mind, and I'll try not to get too emotional about it. But she came and visited us from out of state. She was looking for a solution for not just her scoliosis in terms of the way it made her body look, but she was having a lot of back pain. And with scoliosis, it can be really hard to determine actually, is that back pain coming from the scoliosis at all? Many times there are other things that play into that. So we had several meetings where we talked about the shape of her spine, how likely it was that the spine would continue to be this way or get worse, what were the best options to deal with this spine. So she went through a very lengthy informed consent process. She was really struggling in a lot of facets of life, including physical pain. There was some emotional and mental pain that went along with this as well. And she just struck me as an incredibly gritty kid. And I could tell she didn't think she was a gritty kid. The hope that was there was fantastic. I felt that with the data we had, with our ability to help her out, she would be a really good candidate for vertebral body tethering. So she went through the surgery, she had a really smooth post-operative course, recovered very nicely, and I actually just saw her recently. She came back from out of state for her 1-year follow-up, and there are plenty of patients who tell me that they're better and they're doing what they wanted to do and they're happy, but this girl was completely transformed. And she told me every single part of her life was better. Her mental health was better, her physical health was better, her pain was gone. And I could just tell that the girl that I knew was inside there, the girl that her mom knew was inside there, had the capacity now, secondary to that surgery she went through, to show forth in full force. And it was quite a force. It was really something to witness. And that will stick with me forever, no doubt.